Sarel Gaur MD. So things that are bad about a purely productivity-based compensation scheme. So the first issue that I can think of is cherry picking. This is something that is way more likely to occur in a system where you're purely productivity-based. So what is cherry picking? Cherry picking is simply the act of a radiologist when they're reading off a common list. You sort of game the system so you access the higher value, higher work RVU cases and sort of snipe those off the list in order to boost your income and productivity, and you leave behind the lower value cases, typically ultrasounds and x-rays, for the other radiologists to read. Because you're being compensated per work RVU, this creates a system where you care a lot more about your own personal productivity and you start to think less about the practice as a cohesive whole. So you basically act in a way that benefits yourself at the expense of other members of the practice. So how do you deal with this? Well, there's actually a pretty straightforward solution. So rather than having a shared work list, you basically create an assigned work list, and somebody creates this work list for you, and it basically has a mix of high and low work RVU cases and is tailored to your specialty. So the next thing that's bad about productivity-based compensation is that it discourages the performance of non-work RVU generating activities. So what are these? These are things generally like hosting a tumor board, doing an educational conference. You can also lump in things like contacting patients or clinicians for non-urgent reasons, or discussing plans of care or coordinating care with other members of the healthcare team. So as you sort of transition from a salaried worker where you're responsible for a multitude of tasks, the productivity-based radiologists tend to become very transactional in nature. Basically, if there's no work RVU value assigned to a task, it's hard to justify it being done. And this sort of brings into play the concept in general of physicians tending to do a lot of work that may not be compensated. I think it's interesting we see this in medicine. We don't see it in other fields like, say, investment banking or law. And imagine asking a lawyer to review a case for free. So how do you solve this problem? I think internally you can solve this problem by potentially assigning a work RVU value to the conference. So within the group, you could say assign a value of, say, 10 work RVUs. And then as long as somebody covers that and takes those work RVUs, you can feel that this is a fair system for the group. So the last thing that I think is a negative of productivity-based compensation models is that it sort of gets away from the real point of medical care. So in training, you sort of develop this understanding of what medical care is and the delivery of medical care, and really how difficult and subtle it is to deliver it effectively. Nowhere in that conversation is productivity mentioned. Healthcare is not simply about creating widgets and producing widgets in high volumes and at low prices. There's a lot of other things involved, and specifically in radiology, one thing that we're trying to focus on is, should we be doing more or less imaging? We're trying to do less imaging and really only do the imaging that is needed. Radiology has become such a good way of evaluating the human body for the presence of disease that it becomes abused. That abuse is exacerbated by the presence of basically untrained individuals that are ordering imaging studies in the ER and urgent care settings. So in a purely productivity-based compensation system, there's really no need or there's no incentive to police the system. Productivity-based compensation system tends to promote, let's create as many widgets as we can for as low a price as possible. We need to sort of change that. We need to align the compensation and productivity. We have to align it with also being a good steward of resources and really using the imaging effectively. And that's kind of what I want to get into in the next segment. We're going to talk about what I think is probably the best compensation scheme, which is really a blend of productivity-based models and a salary-based model. So you guys are watching Sarel Gaur MD.